Joining us on the broadcast this evening is Dr. Tanmay Motiwala. He's a senior resident at AIIMS Jodhpur, Department of Pediatric Surgery. He is currently COVID positive and in isolation. Dr. Tanmay, thanks very much for speaking with NDTV. I want to begin by asking you, how are you feeling?
Yeah, hello. Thanks for asking that. Feeling better now. So I tested positive on 5th of Jan, possibly getting contacted with the patient in the ICU, after which I had mild headache, and there was profound weakness actually, which was the predominant symptom for me. I isolated immediately and then found myself to be COVID positive. Better now. Thanks.
Right. Doctor, this is a huge cause of concern. You're joining us from Rajasthan, you're joining us from Jodhpur, but pan-India, there are reports coming in of doctors testing positive, and in certain hospitals, one is seeing hundreds of doctors testing positive for COVID at the same time. Why is this happening? Is it an indicator perhaps that vaccine immunity is waning?
So probably there are two aspects to this. We did come up with a schedule wherein the booster shots for the vaccine were due at this particular time. Unfortunately, the wave has hit just at the time when this was supposed to begin. And the second thing is probably the Omicron has got a higher infectivity rate as compared to the Delta variant, which was previously there. Because I have served in the previous wave as well,
yes.
And we'd see doctors getting hit, but this time the numbers seem to be pretty high to begin with, because the number of doctors that are coming in, I have been in contact with lots of doctors via various social media platforms. I can see at some places the entire department is getting positive, and like without resident doctors, it is difficult to function an entire hospital. So this is something which is really worrisome for all of us.
Right. Doctor, as someone, who understands the space, as someone who's, worked through the previous waves of COVID as well, you contracted the infection, you are in isolation at the moment. What do you make of, many experts, even health ministers of states coming out and saying that, Omicron so far isn't a cause of concern, hospitalizations remain low. This whole theory that Omicron is in fact mild, because the World Health Organization in the last 24 hours has said it was a mistake to actually term Omicron as mild. Is it mild?
So before looking at that thing particular, if you're talking about Omicron being mild or not, let us understand that it is the sheer number of cases that is going to overburden the already jeopardized healthcare system, which is trying to recover from the second wave, And we already had an instance, people are aware that there was an entire 0 year where we did not have a set of almost 40,000 doctors that could not join in. So the other doctors have passed out. There is a scarcity of manpower. People are also depressed, the healthcare workers who had fought there in the last wave, they did see lots and lots of deaths, and they also have to get over it, those things are there. And the third thing is, since we are comparing the symptoms, I would say, okay, the symptoms may be lower for people who are having a good immunity, but it can again be deadly for the people who are at high risk. So let's not take it lightly, because the people who are having good immunity may just escape this, but they may end on passing it to their loved ones who may be at risk. So let's not take it lightly.
You raised two very important points, and I'm going to address those one by one. One is, you talked about symptoms. The symptoms are mild. There are a lot of doctors and experts who are saying that there isn't as much lung involvement with Omicron cases. One is therefore hoping against hope that the oxygen requirement, for patients will be lower than what we saw during the Delta surge and the second wave. What are you experiencing in terms of symptoms? What have you clinically seen in your patients as well? Are Omicron symptoms different from Delta?
So the first thing is, it's very difficult to distinguish in lots of cases, because genomics, the sequencing is very expensive, and you cannot get it done in almost all the patients that you have. So you cannot actually differentiate it as Delta or Omicron in lots of patients. And as I was seeing your numbers as well, which are coming in, we are knowing only those set of numbers which have come in, and those represent a very small fraction. if you're looking at the trend, yeah, I would say that okay, the lung part, the symptoms, those were there that in the last wave. These are probably on a lower side this time around. But let's also take this fact again, because if some patients do get admitted and they fill up the entire hospital beds, the routine patients will suffer.
Absolutely.
So this thing should be taken care. So let's do give that
absolutely.
aspect
In fact,
well.
across hospitals, in metros, one is already reading of X percentage of beds being reserved for COVID patients, which essentially means that somebody who's in need of a non-essential surgery or procedure is already being put on a waiting list. My last question to you, Dr. Tanmay, you also addressed the fatigue. The fact that one is talking so much about, the healthcare system being overburdened, but what about fatigue among doctors like yourselves who've been battling the pandemic on the front lines for the last 2 years? How prepared are we for the onslaught of the third wave in that sense?
So I think we were quite prepared. We did consider this wave coming in, looking at the numbers that have come outside. But the fatigue is always going to be there. You cannot rule it out. If we get decent support from the people out there, if we have people who show some empathy for the healthcare workers, you just have to do your part. Everyone is a hero sitting in their homes. You don't have to go out and fight the COVID like we are doing, and we are having some scars. Those scars are denting us down, but we'll be back again. So I'll recover. I'll be probably out there serving again. Most of the doctors are doing this. This is going to be there, but please do your part. You, all the common people that are listening to us, you all are heroes. Please do take care. Basic precautions are the ones that we are asking for. Put your mask up. Take care, and probably if we can, the only way to defeat the virus is to provide the virus with no host. And this can only happen if we are going to go for mass vaccination, which we are already doing. And the second thing is we have to protect ourselves. If the virus keeps on finding a host, some weaker host will come in, and then it will again mutate. And
each individual really has to do their bit. I think that's an important message. Very last question to you, Doctor, before we let you go. Would you have liked to get your booster shot earlier? Do you think that would have given you an enhanced level of protection from COVID?
I was actually waiting for my turn, because seeing numbers coming in, I definitely wanted to have the booster shot. But again, I was unlucky with that thing. Probably will have the natural antibodies. Thanks for having me.
Doctor, we wish you a speedy recovery. Thank you so much for speaking with NDTV.
Yeah, thanks a lot.